This video is a teaching tool for a method of implant removals called the pop-out method or the fingers-only method. And this is a method of removals that can be used in almost all cases, especially if it's a well-placed, palpable implant. And the key to doing a fingers-only removal successfully is to making your incision in the correct place. So we're going to go through a couple of different examples of removals, and I'm going to talk about where the incision was made and how to use my fingers so that the implant pops out. In this example, I'm manipulating the implant so that the distal tip pops up under the skin, and I make a little dot with a Sharpie right where the tip is. When I let go, it lies back down, so it won't be lying where I'm going to make my incision. I want to make my incision where the dot is. So I sterilize the arm with 2 betadine swab sticks, and I've drawn up 1 cc of lidocaine with epi in a TB syringe. I only need to draw up 1 cc, and then I give half a cc by making a small wheel and then injecting a little bit more under the tip of the implant. Once she's numb, and I test her first, I use an 11 scalpel to make a stab incision right where my dot is, and then I use my fingers to manipulate the implant so that the tip is popping up into the incision. Then I just use the scalpel only to nick away at the fibrous sheath that's formed around the implant until it pops right out. So it takes a little bit of patience, but after a couple of seconds it pops out and you can grab it with your fingers. Then I just close the incision with 2 steri strips. So here's another example. I'm numbing the arm with the lidocaine with epi. And again, I always test her before I do the incision just to make sure she really is numb. And I'm making a stab incision at the dot, and then using my fingers to help the implant pop into my incision. And just using the scalpel very carefully, nicking away kind of in a little X shape until the implant pops up. And in most cases, the removals will take from 30 seconds to maybe up to 3 minutes. It should be very straightforward. With this technique, you use less anesthesia and make a smaller incision than if you do a removal using instruments. So here I'm holding the implant steady using the scalpel, and within a few seconds the implant pops right out. It's very satisfying. So again, this method is excellent and easy to learn, and in most cases should be the first method that you use for a straightforward implant removal. Thank you.